Okay, ladies and gentlemen, good evening. Let's today proceed with our final version for clinic records management system. So this round, we'll start with the dashboard. I have logged in as a super user, admin, or a doctor who owns the business or who owns the clinic. This system is a complete or fully detailed clinic management records or medical records management system. So it entails here, it allows different users. For example, let's say doctors, nurses, pharmacists, and lab attendants, and very many others who are working in that department. So around here we have these different dashboard cards which appears here, but these ones they appear only when you allow them to be. One, we have what we call home. On the home page, only what we see is the number of patients which we have recorded in the system. We have the pending tests. We have the pending test. We have treatment logs. We have invoices. We have credit sales and all others which will appear here. Then here we have also on the dashboard, we also have the expired medicines, a date recorded, batch number, initial quantity, status, or expired date. Here to be showing you the expired date. This is the medicine which got expired long time ago. So here we have 100 pieces which is in stock, and all of them got expired. And even those ones which are not expired will be seeing the number of days remaining. So starting with, since the clinic or what we call medical chambers have different levels before a patient reaches the doctor, he or she must pass through different rooms to reach a doctor. One, we say as a patient enters the clinic or hospital or any other medical chamber, he has to first register. He or she must register first. That means you go to the reception whereby will also have his or her own account registered in the system and given his module of patient management. In that, when the reception register a patient, for example, he will create his details here. If I say create patient, you will see here the details. We first say first name, surname, phone number, address, date of birth, gender, blood group, chronic illness, post medical history, next of kin phone number, next of kin, then referred from. All this can be got here. But before that, I will be showing you the example of one page I had recorded as a demo. For example, this one here. This one, if I click on details, I click on details of this person, you can see all the records of this person so far, what we have recorded. Create triangle, create medical forms, invoice, investigations, other forms, edit patient biodata, a request test, and all other things. All of them are here. That means if you register this patient, it means when a doctor logs into the account or where this patient will be attached to, that doctor will be seeing it as a paying patient. Will be seeing as a paying patient. Okay. Now look at this. Here we have what we call doctor's room. That means if doctors are also registered in the system, they can be also attached to their module for doctors. And a doctor, we look at patient. For example, this one. We look at patient. For example, that one. Patient is there, however it is pending. Then we look at medical forms. Here, if you on patient here, you look, even a doctor can also register a patient, but also if this patient are registered by the receptionist, here will be seen as pending. You can see number, date, name, age, gender, balance, referral form, referred from, by, then action. Action will be also missing that side. Also have here what we call medical. We have what we call medical forms. All of them can be viewed by a doctor. Medical forms can be viewed by a doctor. We have the medical forms which can be viewed by a doctor. Here you can create the new medical form. You can create the new medical form. Things that are concerning with this person. Immediately this person will be selected. Then here you type a person you want. Then you type in weight, height, pressure, temperature, heat rate, body mass index. Then you save, and the rest of the things will be coming there. Then we have referral form, we have discharge form, we have birth card. Okay, we have those birth cards. That is done by a doctor. Then here we have departments. You can add as many departments as you want. One, we have laboratory, and this one, emergency, radiography, and everything. All of them can be seen there. We have finance. In finance, we manage the invoices, we manage sales, we manage expense records, we manage create expenses, we manage expense categories. That's all of them falls under finance. Then this one, it works in the clinic, or in the pharmacy. For example, every clinic must have like a small pharmacy, or where they sell the medicine from, tablets and the rest. Here, when you look at medicine, here we record the medicine, then medicine stocks. Medicine stocks, here you can see the name of the medicine, category, unit sold, unit left, buying price, selling price, and then action. Okay, you can view the stock. You can see here batch number, initial quantity, status, expiry date, then action. You can either edit or delete the medicine. Okay, you can either delete or edit the medicine, and also all of them here are here. You can add the medicine in this format. Just click that button. The name, the category, is it a product or a service? Then medicine form, is it liquid, tablet, capsules, and the rest of as is seen here. Then buying price, sale price, then description of that medicine. Then you save. Okay. After saving, then you have here, you can view the stock, because after adding that one, you can view the stock again. Then you stock that quantity of the medicine you want. Then we have different users. Users also can be managed here. You can add users, you give them permissions. For example, if I look at this person here, as me, if I look at the permissions, what you enable is what appear this side. For example, if you look at all these modules, I have enabled them here. So if I go and I disable one of the reports, I click this one, that means I will not see this report again. Then I refresh. It means now in my account, I will not see the report because this one will have been disabled. If I come again, I want to disable this one for patient. If I look through where the patient is, for example, like this one, I don't want this person to view the patient. That means I will come disable this, remove. So when I refresh, it means that one will not appear again for patient. You see it? That means if you register a new user, and you don't want to see what different modules, then you can disable them. If I come here on medicine, I look for medicine, where medicine is, then I disable that. I disable that for medicine also. Then if I look at for users, as well, you can disable users, doctor's room, everything can be disabled there. But make sure enable only what that person you want them to view. So this system is very user friendly, and it aligns with the Ugandan's ways of work in the pharmacies, clinics, medical chambers, hospitals, and the rest. So if you feel like you want the system, please don't hesitate. Please reach me on my numbers, which are in the description on these details of the YouTube description. Please reach me, don't hesitate. We can negotiate the price. Thank you very much.